What if I told you there is one single oil, something you can probably find in your kitchen right now, that has been shown in clinical research to help lower blood sugar levels and at the same time protect your heart? And no, I am not talking about some exotic supplement that costs you a fortune or something you have to order from the other side of the planet. I am talking about something that has been used for thousands of years, something that entire civilizations were built on, and something that modern science is now confirming is one of the most powerful natural tools we have for metabolic and cardiovascular health. Now, before you scroll away, before you think this is just another health video making big promises, I want you to stay with me because I am going to walk you through the actual science, the real studies, and exactly how this oil works inside your body to do what it does. My name is Dr. Clarence Martin, and I have spent years studying nutrition, metabolic health, and the way food interacts with our biology. And I can tell you with full confidence that this is one of those things that genuinely deserves your attention. So stick around because by the end of this video, you are going to understand exactly what this oil is, why it works, how much you should be using, and the mistakes most people make that actually cancel out the benefits. Let us get into it. So the oil I'm talking about today is extra virgin olive oil. Now, I know some of you might be thinking, olive oil, really, that is the big secret, and I completely understand that reaction because olive oil feels so ordinary, so common, that it is easy to overlook it. But here is the thing about medicine and about nutrition in general. Sometimes the most powerful tools are not the flashy new supplements or the latest trending superfood. Sometimes they are the things that have been quietly doing incredible work for centuries, and we just did not have the science to fully understand why. Extra virgin olive oil is one of those things, and the research behind it, especially in the last 10 to 15 years, has been absolutely extraordinary. Let me start with blood sugar, because this is something that affects hundreds of millions of people around the world. We are living in the middle of a metabolic health crisis. Type 2 diabetes is skyrocketing. Prediabetes is even more common. And insulin resistance, which is the underlying driver of so many of these problems, is something that a shocking number of people are dealing with and do not even know it. When you eat food, especially carbohydrates, your body breaks those carbohydrates down into glucose, which enters your bloodstream. Your pancreas then releases insulin, which is the hormone that tells your cells to open up and let that glucose in so it can be used for energy. That is the normal healthy process. But when you are constantly flooding your system with processed carbs, with sugar, with refined foods, your cells start to become resistant to insulin. They stop responding the way they should. So your pancreas has to pump out more and more insulin to get the same job done. And over time, this leads to chronically elevated blood sugar, chronically elevated insulin, and eventually it can lead to full-blown type 2 diabetes, along with all the complications that come with it, things like nerve damage, kidney damage, vision loss, and a massively increased risk of heart disease. Now, here is where extra virgin olive oil comes in, and this is where it gets really fascinating. Extra virgin olive oil contains a compound called oleic acid, which is a monounsaturated fatty acid, and it also contains a range of polyphenols, which are powerful antioxidant and anti-inflammatory compounds. One of the most studied of these polyphenols is something called olopin, and another one is called hydroxyol. These compounds have been shown in multiple studies to improve insulin sensitivity. What that means in practical terms is that when you consume extra virgin olive oil regularly, your cells become better at responding to insulin. They do not need as much insulin to do the same job. Your pancreas does not have to work as hard. Your blood sugar stays more stable, and you reduce the risk of that dangerous cycle of insulin resistance that leads to so many chronic diseases. There was a study published in the journal Diabetes Care, which is one of the top journals in the field, that looked at people following a Mediterranean diet enriched with extra virgin olive oil compared to people following a standard low-fat diet. The group consuming the olive oil-enriched diet had significantly better blood sugar control, better insulin sensitivity, and a lower incidence of developing type 2 diabetes over the course of the study. And this was not a small study or a short study. This was part of the PREDIMED trial, which is one of the largest and most well-designed nutritional studies ever conducted, involving thousands of participants over several years. The results were so compelling that the trial was actually stopped early because the benefits of the Mediterranean diet with extra virgin olive oil were so clear that the researchers felt it would be unethical to continue withholding those benefits from the control group. But it does not stop there. Another study published in the Annals of Internal Medicine found that people who consumed about 4 tablespoons of extra virgin olive oil per day had a 40% reduction in their risk of developing type 2 diabetes, compared to those who did not. 40%. Think about that for a moment. That is a massive reduction in risk from something as simple as incorporating a natural whole food oil into your daily diet. And the mechanism behind this is not just about insulin sensitivity. The polyphenols in extra virgin olive oil also help protect the beta cells in your pancreas, which are the cells responsible for producing insulin. When those beta cells get damaged, which happens over time with chronic high blood sugar and inflammation, your ability to produce insulin declines, and that is when things really start to go downhill. By protecting those cells, extra virgin olive oil helps preserve your body's ability to regulate blood sugar naturally. Now let me shift gears and talk about heart health, because this is the other side of the coin, and it is just as important, and honestly, the evidence here is even more extensive. Heart disease remains the #1 killer worldwide. It kills more people than cancer, more people than accidents, more people than infectious diseases. And the tragic thing is that so much of it is preventable. So much of it comes down to lifestyle factors, to what we eat, how we move, how we manage stress, and what we put into our bodies on a daily basis. Extra virgin olive oil has been studied extensively for its cardiovascular benefits, and the results are consistently impressive. First, let us talk about cholesterol. Now, I want to be careful here because the cholesterol story is more nuanced than most people realize. It is not simply about total cholesterol being high or low. What matters much more is the type of cholesterol you have and the state it is in. LDL cholesterol, which is often called the bad cholesterol, is not inherently dangerous on its own. It becomes dangerous when it becomes oxidized. Oxidized LDL is what actually contributes to the formation of plaques in your arteries, which is the process called atherosclerosis, and that is what leads to heart attacks and strokes. Here is the key point. The polyphenols in extra virgin olive oil, particularly hydroxyol, have been shown to prevent the oxidation of LDL cholesterol. The European Food Safety Authority actually approved a health claim for olive oil polyphenols based on this evidence, stating that olive oil polyphenols contribute to the protection of blood lipids from oxidative stress. That is a regulatory body looking at the science and saying, yes, this is real, this is significant, and this is something people should know about. But the heart health benefits go beyond just protecting LDL from oxidation. Extra virgin olive oil has also been shown to improve endothelial function. Your endothelium is the thin layer of cells that lines the inside of all your blood vessels. When your endothelium is healthy, your blood vessels can dilate and constrict properly, blood flows smoothly, and your blood pressure stays in a healthy range. When your endothelium is damaged, which happens from chronic inflammation, from oxidative stress, from poor diet, your blood vessels become stiff, blood pressure goes up, and the risk of cardiovascular events increases dramatically. Studies have shown that the oleic acid and polyphenols in extra virgin olive oil help improve endothelial function, help your blood vessels relax, and help maintain healthy blood pressure. A meta-analysis published in the journal Lipids in Health and Disease found that regular olive oil consumption was associated with significant reductions in both systolic and diastolic blood pressure, and the effects were more pronounced with extra virgin olive oil compared to refined olive oil, which tells us that those polyphenols really do matter. There is also the anti-inflammatory effect to consider. And this is huge because chronic low-grade inflammation is now understood to be one of the primary drivers of virtually every chronic disease, including heart disease and diabetes. The polyphenols in extra virgin olive oil, particularly ulocanthal, have been shown to have anti-inflammatory properties similar to ibuprofen. Now, I am not saying olive oil is a replacement for medication. That is not what I am saying at all. But the fact that a natural food compound can exert similar anti-inflammatory effects as a pharmaceutical drug tells you something about how powerful this oil really is. By reducing chronic inflammation, extra virgin olive oil helps protect your blood vessels, helps protect your heart, helps protect your pancreas, and helps create an internal environment where your body can function the way it was designed to. Now, I want to address something really important because I know a lot of you are going to ask about this. Not all olive oil is created equal. This is a critical point And if you miss this, you could end up spending money on something that does not give you the benefits we have been talking about. When I say extra virgin olive oil, I mean specifically extra virgin. This is the highest quality olive oil made from the first cold pressing of the olives with no chemical processing, no heat treatment, and no refining. It is essentially fresh squeezed olive juice, and it retains all of those incredible polyphenols and antioxidants that give it its health properties. Regular olive oil, light olive oil, pure olive oil, these are all refined versions that have been processed in ways that strip out most of the beneficial compounds. They still contain oleic acid, so they are not terrible, but they are missing the polyphenols. And as we have discussed, the polyphenols are a huge part of what makes this oil so special for blood sugar and heart health. So how do you know if you are getting the real thing? First, look for the words extra virgin on the label. Second, look for a harvest date, not just an expiration date, because you want oil that is as fresh as possible. Third, look for oils that come in dark glass bottles because light degrades the polyphenols over time. Fourth, look for a certification seal from a reputable organization. And fifth, do a taste test. Real extra virgin olive oil should have a peppery, slightly bitter taste. If it tastes bland or greasy, it is probably not high-quality extra virgin. That peppery sensation in the back of your throat is actually caused by oleoanthol, the anti-inflammatory compound I mentioned earlier. So if you feel that little kick, that is actually a good sign. Now let us talk about how much you should be using and how to incorporate it into your daily routine. Most of the studies that showed significant benefits used between 2 to 4 tablespoons of extra virgin olive oil per day. That is roughly 30 to 60 millit. Now I know what some of you are thinking, that is a lot of oil, that is a lot of calories, and I hear you. Extra virgin olive oil is calorie dense. There is no getting around that. 1 tablespoon has about 120 calories. So if you are having 4 tablespoons, that is almost 500 calories just from oil. This is why it is important to use olive oil as a replacement for other fats in your diet, not as an addition on top of everything else you are already eating. Replace the butter, replace the vegetable oil, replace the canola oil, replace the margarine. Use extra virgin olive oil instead. Drizzle it on salads, use it to cook vegetables, add it to soups, dip your bread in it, use it as the base for dressings and marinades. When you use it as a replacement rather than an addition, the calorie concern largely goes away because you are simply swapping one fat source for a much healthier one. And speaking of cooking, I want to clear up a common misconception. A lot of people think you cannot cook with extra virgin olive oil because it has a low smoke point and it will become toxic when heated. This is largely a myth. While it is true that extra virgin olive oil has a lower smoke point than some refined oils, it is still perfectly suitable for most cooking applications, including sautéing and even moderate temperature frying. Research has actually shown that the antioxidants in extra virgin olive oil help protect it from breaking down during cooking, making it more stable than many other oils that have higher smoke points but fewer protective compounds. A study published in the journal Antioxidants found that extra virgin olive oil retained most of its polyphenol content even after being heated for typical cooking durations and temperatures. So do not be afraid to cook with it. Just avoid using it for deep frying at very high temperatures and you will be fine. I also want to talk about something that does not get discussed enough, which is the synergistic effect of combining extra virgin olive oil with other healthy foods. The research shows that the benefits of olive oil are amplified when it is consumed as part of an overall healthy dietary pattern, particularly a Mediterranean-style diet rich in vegetables, fruits, whole grains, legumes, nuts, seeds, and fish. The polyphenols in olive oil actually help your body absorb fat-soluble nutrients from vegetables more effectively. So when you drizzle extra virgin olive oil on your salad, you are not just getting the benefits of the oil itself, you are also enhancing the absorption of vitamins A, D, E, and K from the vegetables in your salad. It is this beautiful synergy where the whole becomes greater than the sum of its parts, and this is one of the reasons why the Mediterranean diet consistently ranks as one of the healthiest dietary patterns in the world. Now, I want to be completely transparent with you because I believe in being honest with my audience. Extra virgin olive oil is not a magic cure. It is not going to fix years of poor dietary habits overnight. If you are eating processed food all day, drinking sugary beverages, living a sedentary lifestyle, and then adding some olive oil on top of that, you are not going to see miraculous results. The power of extra virgin olive oil comes when it is used as part of a comprehensive approach to health that includes a balanced whole foods diet, regular physical activity, adequate sleep, stress management, and all the other foundational pillars of good health. It is a powerful tool in the toolbox, but it is one tool among many, and it works best when all those tools are being used together. I also want to mention that if you are currently on medication for blood sugar or heart health, do not stop taking your medication because you watch this video. That is not what this is about. This is about adding something beneficial to your life, not about replacing medical treatment. Always work with your healthcare provider. Always follow their guidance. And if you want to make significant dietary changes, have that conversation with your doctor first. What I will say is that many doctors, myself included, are increasingly recognizing the role that nutrition plays in managing and even preventing chronic disease. And many of us are enthusiastic about patients taking proactive steps with their diet. There is one more thing I want to share with you before we wrap up, and it is something that really struck me when I was going through the research for this video. There was a large observational study published in the Journal of the American College of Cardiology that followed over 90,000 people for more than 20 years. The researchers found that people who consumed more than half a tablespoon of olive oil per day had a 19% lower risk of cardiovascular disease mortality and a 17% lower risk of cancer mortality compared to those who rarely consumed olive oil. And when the researchers looked at what happened when people replaced other fats in their diet with olive oil, the results were even more impressive. Replacing margarine, butter, mayonnaise, or dairy fat with an equivalent amount of olive oil was associated with an 8 to 34% lower risk of total and cause-specific mortality. Those are not small numbers. Those are life-changing numbers. And they came from something as simple as choosing a different type of fat. I find that incredibly empowering because so often in health and medicine we focus on complicated interventions, expensive treatments, and difficult lifestyle changes. But sometimes the most impactful thing you can do is something as simple as changing the oil you use in your kitchen. It does not require a prescription. It does not require a gym membership. It does not require a complete overhaul of your life. It just requires a small, consistent daily choice to reach for extra virgin olive oil instead of the alternatives. So let me leave you with this. If you take nothing else from this video, remember these 3 things. 1. Extra virgin olive oil has been shown in rigorous scientific studies to help improve insulin sensitivity and lower the risk of type 2 diabetes. 2. It has been shown to protect your heart by preventing LDL oxidation, reducing inflammation, improving blood vessel function, and lowering blood pressure. And 3. The quality matters enormously. So invest in real extra virgin olive oil, store it properly, and use it consistently as your primary fat source. I truly believe that this is one of the simplest and most effective dietary changes that most people can make, and the science backs that up overwhelmingly. If you found this video helpful, please hit that like button because it helps more people find this information, and I genuinely believe this is information that can change lives. Subscribe to the channel if you have not already because I put out videos like this regularly where I break down the science behind nutrition and health in a way that is practical and actionable. And if you have questions, drop them in the comments below. I read every single comment and I do my best to respond to as many as I can. This is Dr. Clarence Martin reminding you that your health is your greatest asset, and the small choices you make every single day are what determine the quality of your life for decades to come. Take care of yourselves. Make informed choices.